Hi, I'm Sam, and this is Ashley, and today we're going to show you dependent, assisted, and independent upward and downward movement in the bed. This skill is important to improve patients' independence and assist in preventing development of skin problems or contractures as a result of lying in one position for too long. So the first thing that we're going to do is we're going to remove any pillows so that we have space to move her forward in the bed. Next thing I'm going to do is I'm going to make sure that I'm close to the bed and that she's close to me so that I can reduce the lever arm and get as much force to move her forward. And then the first thing I'm going to have her do is flex her hips and knees forward like this. I'm going to get close, support her head and upper trunk, and as I lift her scapula up off the ground, I'm going to have her lift her pelvis and push forward like this. And that's forward movement. You're only moving 6 or 10 inches. All right, next one we're going to do is moving downward. I'm going to have her do the same thing, flex the hips and the knees, and support her head and upper trunk. And this time she's going to push downward as I lift her up. Boom. And that's that. Now, if the patient is fully dependent, you may have to flex their knees and hips for them. And also, depending on how big the person is, you might have to get a second person to help lift them and move them totally because they're not going to be able to push with their feet to help. All right, sometimes you'll need 2 people to move a person upward or downward. In this case, it's a lot of times it's easier to use a draw sheet. You'll place this draw sheet underneath her bottom up to her upper back, and we'll do the same thing as before. We're just lifting her with the sheet. So another thing to remember is to have her cross her arms to get them out of the way, and then I'm going to count to 3, and me and Katie are going to lift her forward. 3, 2, 1. That's forward. And then if we want to do downward, we would do the same thing. 3, 2, 1, down. That's how you do that. All right, now I'm going to teach you all how to instruct the patient to do the upward and downward movement independently. So first of all, we're going to move the pillow like we did before, and you're going to tell the patient, like before, to flex her hips, knees, and to put her feet flat on the ground. But this time we want her to bring her feet as close to her bottom as possible. Good. All right, next we're going to have her keep her elbows on the table, and she's going to push down with her elbows to lift her trunk up off the ground while simultaneously pushing with her feet to move her this direction. So go ahead and good. So that's how you move forward. To move down, you're going to do the same thing, but this time she's pulling with her feet. So she's going to flex her hips and knees, but not as close to her bottom this time. She's going to push down with her elbows and lift up her trunk and then pull with her feet to move this direction. And that's how you do it. Have her do it independently. Now sometimes if she doesn't move as far with one movement, you can have her do it again to get farther down the bed or up the bed.